Hi guys, this is Mrs. Hall with your unit on doing a surgical dressing. As with any procedure, you are expected to introduce yourself, identify your patient, explain, educate, and get consent for your procedure. Gather your equipment, ensure that there is a trash receptacle you can use, and ensure that you have everything you would need for every possible situation. Hand hygiene is a must, which is included in another video linked in the video card above, as well as in the description section below. Ensure that you provide privacy for every procedure and ensure that the patient position is appropriate for the procedure you are about to perform. In this case, I'll be doing a dressing on an abdominal wound, so I want to have my patient lying supine if it is not contraindicated. The reason for this is when you do a dressing, you want to have full access to the area. Also, it would be mighty uncomfortable for the patient to go from a semi-Fowler's position to a standing position if the tape application is not strategically done. For this procedure, you want to apply clean gloves to remove the old dressing and gain access to the wound. Gently remove the tape and remove the dressing away from the patient's face. This prevents the possibility of bothering the patient with the site of the wound early on in the procedure. Assess the wound by describing the condition, color, and temperature. Use correct terminologies to describe your findings, such as ecchymosed, which means bruised, erythematous, red, indurated, firm, edematous, swollen. Wound edges must also be carefully defined. Wound edges can be described as diffused, well-defined, or rolled. Next, describe the type of tissue found in the wound. Normal granulation tissue has a beefy, red, shiny, and textured appearance that bleeds easily. Necrotic tissue is usually gray and soft and is called slough. Black, gray, hard, leathery tissue is referred to as eschar. Note the amount, color, and consistency of the drainage. That's called exudate. Drainage can be serous or clear, serosanguinous, blood-tinged, or sanguinous, bloody. Drainage from heavily colonized wounds may have a tan or milky appearance. Odor in the wound is a significant diagnostic tool. Blue-green drainage combined with a musty odor usually indicates the presence of Pseudomonas in the wound. So at this point, you would now remove the innermost dressing to protect the wound from exposure and the patient's potential temptation to touch while you are preparing to do the dressing. Open your tray. Open all sterile equipment. Don your sterile gloves and prepare your tray. Pour the solution and prepare your swabs. Again, there is a video on this in detail in the video card above, as well as in the description section below. Use forceps to remove the dressing that protects the wound. This is done to keep your hands sterile before you attend to the wound. Be sure to always operate your forceps held downward. Clean outward from the wound using single swipes with your gauze pads. If there's a drainage, hold the drain erect and clean thoroughly without pulling on the equipment. Then dry the surrounding skin, avoiding the wound itself. This is to ensure that there is no undue irritation to the wound itself or debris left behind from dry gauze. Apply your gauze dressing to the wound, making sure to avoid moving the dressing once it's been put in place. Try to ensure that your dressing is as close to the size of the wound as possible, but be sure to cover the wound and its surrounding areas. Apply 2 layers, an inner layer which comes in direct contact with the wound, and an outer layer, which is in contact with the tape that secures the dressing. Secure the dressing with tape starting from the center of the dressing. Avoid using vertical tape application as it causes undue tugging on the skin as the patient changes position. Horizontal applications are more conducive to comfort and movement. Cover the entire gauze. We rarely have waterproof dressing covers in Belize, so you have to be sure to cover the entire gauze. This avoids having exposed ends that can get caught on objects as the patient moves. And it also plays a role in the prevention of infection, as wounds that are soaked are better off if they are sealed, since it will prevent or hinder the entrance of bacteria by way of that exposed soaked dressing. Be sure to cover at least a ½ inch border around the dressing to ensure that the wound is sealed. With the dressing done, you can make the patient comfortable by removing the drape if you had applied one and replacing their clothing. Pack up your soiled material and cover the dressing tray, then doff your glove. Replace the bed rails if necessary and adjust the bed height accordingly. You can then open the curtains and wheel your trolley onto the slush room where you care for your equipment.